Thanks very much, Mr. Deputy Speaker, and interesting to hear the front bench exchanges. Although I'm surprised there are not more members in here for what is a very, very important debate. Back in, where are they on both sides, actually? Considering this is the number one priority of the opposition, where are they as well? Back in, it's always been my number one priority, without the heckling from the back row. Back in July, Mr. Deputy Speaker, the Health and Social Care Select Committee, which I now chair, published a crucial report titled Workforce Recruitment, Training and Retention in Health and Social Care. I would urge colleagues on all sides to have a look at it if they haven't already. We looked at workforce issues right across the NHS, and I have to say its findings were stark. The report found that the NHS workforce is facing the biggest challenge in its history. It made the same point about the social care workforce, actually, and although social care is not the primary focus of today's debate, obviously it's important to stress, as others have during today's opening exchanges, that the two sectors are obviously closely intertwined, and the workforce problems in the NHS cannot be considered in isolation. On the industrial action, we had the NHS providers before the Select Committee this morning, and I asked them whether they support the independent pay review process, and it was a question that I would have intervened on the opposite front bench, but it had already gone on an hour, so I thought he deserved to sit down. Over 1 million NHS workers under Agenda for Change have had, as the Secretary of State said, a £1,400 pay rise this year. And that has come out of the independent pay review process. Now, the question I asked NHS providers this morning, to which the answer was yes, is do they still believe in the independent pay review process? Because either we have that process and we believe in it and we respect it, or we don't. If we're saying that we have that process and then that process sticks until something else comes along, and then ministers are directly involved in negotiating pay for NHS workers, that's a very, very different proposition. I don't think that's the place where we really want to be, although the Select Committee is very happy to scrutinise that if that's a proposal coming from the Treasury bench. But I would be interested to know in winding up today whether that is what is the Labour Party position on the independent pay review process, because it is clearly an independent process for a reason. So I just wanted to put that out there. Now, the committee's report on workforce that I note, Mr. Deputy Chairman, cited research by the Nuffield Trust that suggests the NHS in England could be short of 12,000 hospital doctors and over 50,000 nurses and midwives. The number of people on a waiting list for treatment rose to a record of just over 7 million in September this year, and the 18-week target for treatment has not been met, as is well known and is a matter on the record since 2016. Yet, as our report noted, the demand on the sector, and I'm going to return to demand in a minute, continues to grow relentlessly. There are estimates that an extra 475,000 jobs will be needed in health by the early part of the next decade. Now, one of the committee's most urgent recommendations was that the government should do proper workforce planning. We noted that without independently verified, publicly available workforce plans, there would be little confidence among the public or the profession, or NHS workers themselves, that the government had got a grip on the problem. Now, we haven't yet, I have to say, the Select Committee haven't yet had a government response to our workforce report. It is a little overdue, so the Secretary of State's on the front bench, and I know he's busy, and hopefully he'll take that back, and in the box we'll hear that. But we look forward to receiving that, because I think it is important that Select Committees do get responses to their reports in as timely manner as is possible. Notwithstanding, of course, I understand that there has been a change of administration. However, I am encouraged that the government is paying attention to what the committee recommended, and I was delighted to hear my predecessor in this role, now Chancellor of the Exchequer, say in his autumn statement that he agrees with himself, his words, that the government would now be publishing an independently verified workforce plan for the NHS for the next 5, 10 and 15 years, something that the committee has long been calling for. The Treasury outlined that the plan would, and I quote, include measures to make the best use of training to get doctors, nurses and allied health professionals into the workforce, increase workforce productivity and retention. Excellent. This is progress. But I think questions do remain, and maybe the Minister could touch on this in her winding up, about what the independent workforce planning will look like in practice. We need to know more about who will provide that independent verification to once the work has been done. And I understand that the work has largely been done by the NHS. We need to know who will be doing that independent verification of it, when it will be published and how regularly it will be reviewed, and obviously who is doing that. When we know that, we will we'll look forward to talking to he or she in the select committee. Now, our report contained a number of other important detailed recommendations, Mr Deputy Speaker, about how to tackle the NHS workforce crisis. I don't want to go into all of them today. That I've said the report is on the record and published in the House, and it is. But among them, I do want to highlight the radical review of working conditions, which has been touched on by the Shadow Secretary of State and the Secretary of State. Working conditions are critical, and we talked about the need to reduce the intensity of work felt by so many people in the service, and I hear that as a constituency MP and as chair of the Select Committee, to boost retention and, of course, recruitment of people who are looking as to where they might work when they've done training. So we recommended this review should start with an overhaul of flexible working, which would mean that NHS workers were not driven to join agencies or become locums to gain control over their working lives. And I often hear that term, that we just need control over our working lives. We also said that it is a huge problem that senior doctors are being forced to reduce their working contribution to the NHS or to leave it entirely because of the long-standing problem, and it was a problem when I was a minister in the department, around pension arrangements. We accept that the government has made some progress on pensions with changes to the taper rate of the annual allowance, and credit to them for that. But we note that the problem persists, and we do call on the government, have called on the government in our workforce report to address it. So in that context, again, credit where it's due, Mr Deputy Speaker, very pleased to see on Monday that the government have announced plans to amend NHS pension rules to retain senior doctors and encourage staff to return from retirement. And the Secretary of State slightly mocked when he said that it's subject to a consultation, but I mean, that is how government works. And you know, if he were to be the Secretary of State, and I like him very much, but I hope he doesn't, if he were to become the Secretary of State, he would also publish consultations in which, because that's the way that proper government is done, and he knows that. So, you know, we look forward to seeing the government's response to that consultation, which I know the Secretary of State will be keeping a very keen eye on. The Secretary of State is absolutely right to say in his statements today that we got a record number of doctors in training. The 5 new medical schools, 2 of them focused on training GPs. That is true, but we're going to return to our workforce work on the Select Committee next year, and you know, we will be taking evidence from anybody who wishes to contribute around the cap on training places. I do think that, and I have said this to ministers, I've said this to Number 10, I do think that the government is going to have to look again at that issue. You know, I hear in my constituency bright young boys and girls who wish to train as medics, maybe their parents have worked in the profession, who want to have that ambition for themselves, and I think the cap is a problem. The other thing, just as I close, Mr Deputy Speaker, is around demand. We had somebody from the BMA GP committee in the Select Committee this morning in our ongoing inquiry about integrated care systems, who was talking about the NHS being underfunded. Well, I mean, it depends on which end of the lens you look at, doesn't it? You know, we spend £150 billion or so of taxpayers' money on the NHS. We could spend £300 billion. That would be a choice. We'd have to fund it, of course, because we know what happens when you make unfunded spending promises from that dispatch box. The markets go into meltdown, and rightly so. But we have to have a serious and honest conversation with ourselves about how much of our national wealth we wish to spend on our health service, and whether that would achieve the outcomes. We're the 5th largest spender on health services in the OECD. We do not get the 5th best outcomes. And to my mind, and I can give the House a bit of an exclusive here, Mr Deputy Speaker, is the Select Committee will be in the new year launching a big inquiry into prevention. Anybody who knows me when I stood at that box as a minister know that cancer and prevention are the two things that most get me out of bed in the morning. We'll be doing a big piece of work on prevention, because my view and many people's view is that the NHS has long-term sustainability challenges if we don't get serious about prevention. And I don't just mean returning to the arguments around obesity and child obesity and all the things that I wrote about in the child obesity plan when I was the health minister. Although they are important, and I would urge the government not to backtrack on any of that. Let's implement those policies, because weight is a major problem in our ill health. But we need to get upstream of ill health. And when we do a piece of work, when we return to our cancer work, and we have a debate in the House on Thursday, and I'll say more about this, when we return to our cancer work and we look at future cancer and we get very upstream of cancers, instead of just, at the moment we want to diagnose quickly, but of course you have to have symptoms in order to diagnose quickly, and then we need to treat very quickly as well within the 28-day standard. We need to get upstream of that. This is something the Secretary of State and I have talked about several times already. We need to get much ahead of that. And there are predictive medicines, biomarkers, some of the life sciences work that's going on, the genomic strategy that the NHS has at the moment. We need to bring that together and get very ahead of some of the illnesses that are driving ill health in our country, because without that the NHS has long-term sustainability problems in my humble opinion. So in all the work that we are doing on the Select Committee, whether that be ICSs or we're looking at the prevention work, the cancer work, and then I look back at some of the work that was done by my predecessor leading the committee. I mean, workforce is without question the common theme that runs through all of them. We can't get away from that. And I think there are encouraging signs that the government are listening to the committee, and of course we have a great advocate in number 11 Downing Street and in the Secretary of State, who I was very pleased to see reappointed to his position. And I urge government to continue to listen to the Select Committee, and we're a cross-party committee. We look at things in a sober and calm and evidence-based way, and we look forward to the Secretary of State coming to see us very soon to talk about some of these issues. And the invitation is always there, as he knows, because the workforce challenges that the NHS faces are the bottom line, and without them we're not going to move forward on many of the challenges that I know the system has. So I do welcome the fact that we have this debate here today, and I hope we can keep it sober, and I hope we can keep the party politics out of it, and focus on the NHS, because ultimately that's what our constituents demand of us. Thank you, Mr. Deputy Speaker.